went to a place called Bessenecker, which was this little municipality in the northwestern corner of Honduras, nestled between El Salvador and Guatemala. It was this beautiful village. I was working in the wash sector, and I was assigned to the Ministry of Health. I wasn't a water engineer, and so in the water and sanitation sector, if you're not a water engineer, that means you're building shitters. And so I was supposed to build latrines, and I remember the Peace Corps telling me that, oh, you're so lucky because this was the decade of sanitation, and there was going to be a shitter at every house. In the case of Honduras, when I did the national level survey, they had built hundreds of thousands of latrines throughout the country. UNICEF, U.S. government, Honduran government. A lot of them weren't working. They were being used as a bodega. People were storing stuff in there because either the behavior hadn't changed or the design wasn't appropriate for the context or the condition. In the case of children, massive amounts of children were using it. So we spent millions and millions of dollars to try to eradicate open defecation, and we failed because we failed to be thoughtful about design, thoughtful about implementation, and considering who all the users were. We focused on adult male user. They use it this way, so build this, and not on all the other users. Diarrhea was one of the biggest killers of children under 5 at that time. Their parents had gone out in the bush, and their parents' parents had gone out in the bush, and fecal transmitted diseases aren't visible. You can't see it. So you're telling me that I'm getting sick because of something that I can't see. It's hard to grasp that. I studied gravity-fed theory, and again, I didn't have the tools, but I made tools, and I surveyed land, and I built water systems. And, sanitation, when research bears this out, is often more impactful than wash, because when you have open defecation, all that washes down into the streams. There's a lot more exposure, and that's how people get sick, and that's how kids die. And so the early part of my career was really around understanding both the design of latrines and how they can facilitate not only effective containment, but actually encourage people to use them. And one of the things that I discovered in those early years of my Peace Corps service, and then I worked for UNICEF in Honduras to do this national latrine survey, was that a lot of children would not use latrines. And I found this out, and I couldn't understand why. People had fear of their kids falling in. Every household had the story of Uncle Pedro falling into the latrine. The slab broke and he fell into the pit, and it was awful, and nobody wants to fall into a pit of shit. And there's this real fear that people had of latrines, and particularly because a child's buttocks is of smaller diameter than the typical seat on a latrine. And they thought adults use latrines, and because adults engage in vices, they were afraid that their kids would catch some sort of transmission, some sort of marasmus of that virus, either in smoking, sexual relations, even spicy foods. All of these things would come up. If we let our kids use the latrine, they're going to pick that up somehow. That opened up a whole other world for me on health beliefs and how people understand how disease gets transmitted, and then how can you design an understanding of those constructs that people have in their head. How can you educate them otherwise? And so I started experimenting, again with my own money, I started experimenting in latrine seat design. And I got this local carpenter in Bessenecker to build me like 5 different prototypes of latrine seats to fit the butt of a young child. And I was fascinated with that because of the impact that it could have. Diarrhea was the number 1 cause of death, children. And child feces is actually more potent than adult feces because their immune systems haven't been built up. So when they defecate outside, the concentration of parasites and bacteria is far greater than an adult. So I figured if I could solve this problem by working with a carpenter on building different latrine seats, man, wouldn't that be cool? There's an effort there's to convince people, one, that you'll even do what you say you're going to do. And I remember I'd go up to these communities, and there were manufactured materials that we'd bring, and there'd be things that we'd ask them to do. And that's a hard thing to do because that takes time out of their day that they're merely getting by just to feed their family. If you've ever dug a 3-meter pit in rocky soil, it's not an easy thing to do. Weeks went by and people had dug their pits and waiting for me to bring the materials, and they never came. And then the rain started, and a lot of these pits started filling in. And this man, Fernando, who was always very subdued and very quiet, he came into the meeting, he came in late, and he was drunk, and he was crying, and he was yelling. And basically what he was saying was, I trusted you. You said you were going to do this, and you failed. And he was right. I had committed something that I couldn't deliver. And I learned very early on in my career that you never do that. You don't commit unless you can deliver, because these people have been failed so many times by so many people, by so many systems. And I became part of that. And I was distraught. And then I also realized there's something I could do about it. I started looking into why didn't they have the concrete and the corrugated roofing. Turns out they had it. It was in the warehouse, but they didn't have money for fuel to bring it up the 20 miles up to the community. And so I said, well, I'll buy the fuel. I've got my Peace Corps stipend. I'm just sitting on it. And it's that understanding. You don't have to just accept things. You can find other ways to do things to make things happen. And I realized that. And so I threw down my, whatever it was, $20. And it solved the problem. And I could have done that 3 weeks ago, but I didn't. But it was a great lesson for me that I've taken with me to this day. It was a great revelation for me. It was one of those lessons in life that you learn about how important your word is, particularly if you want people to trust you, and particularly people who live on the edge. The consequences are far greater when you're living at the bottom of the pyramid. That failure of mine was a great teacher of how I needed to behave throughout my career if I was going to be successful, meaning that I was really going to have impact and change in the world. That really started another great lesson for me, was to understand, now we call it human-centered design. Back then that term didn't exist, but the need for it existed, which is, you should check with the user first.